Imagine going to the doctor's office and the way you were treated led to you getting sicker.
That's what 25% of LGBTQ plus adults say they have experienced. West 2's Sheldon Dutez joins us now. And Sheldon, for straight adults, so to speak, it's just 9% of adults.
Yeah, big disparity there, as you guys can both see. And some of our local healthcare providers are combating that fear of discrimination. And they are making sure that gay, lesbian, and trans patients feel comfortable getting their overall health and wellness needs taken care of.
There's two people you don't like, either your priest and your doctor, and for a reason. I need to understand who you are as an individual to know how to best treat you.
That's why Dr. Adrian Burrows strives to create a friendly environment for all of the patients at his primary and geriatric clinic in Castleberry. Between friendly greetings in the hallway,
Hi there. Hi. How are you, dear?
Hi, how are you?
I'm well.
to rainbow-colored signs like this one, patients know everyone is welcome.
They can come here regardless of their religious affiliations, regardless of their political affiliations, regardless of their race, regardless of their gender. They are welcome here.
Which is especially important for LGBTQ patients. Public charity KFF tracks national health policy research, and they report that almost 40% of gay, lesbian, and trans patients are less likely to get health care after having a negative experience with a doctor or nurse, compared to 15% of non-LGBTQ patients. Fear of discrimination may also hinder patients from sharing their sexual orientation, which may prevent them from getting routine care for treatable conditions or ailments.
Everyone's always talking about STI testing, but there's a higher rate of depression, there's a higher rate of obesity, higher rate of cardiovascular disease, higher rate of domestic violence. And so there are a lot of things that we need to screen for that a lot of primary care doctors are not addressing.
People might be watching this story and they might be critical and say, well, why does my doctor even have to know that? Or why does that person have to share that side of themselves with their doctor?
Again, I think society has made everything taboo. And I think this is a topic that people don't understand. In order for me to appropriately screen and to take care of you, I need to know who you are.
That kind of trustworthy relationship is what led Josh Marlowe to Crew Health in Orlando for his primary care needs.
The services were really good, the physicians were great, and I felt that I had a little bit more of a personal and relatable experience versus the standard run-of-the-mill medical facility.
And tell me, what was so different about your experience with Crew versus what you were experiencing in traditional medical settings?
No judgment,
Yeah.
no biases, just everyone's kind of in the same boat.
Crew Health, we are a one-stop shop for all things primary care with an LGBT focus.
Brittany Acuff is Crew's Chief Operating Officer.
So you can come to see us and have your mental health worked on, you can have physical health, you can have full body health, as well as we have an in-house pharmacy.
And physician assistants like Heather Beatty help patients feel comfortable.
Nature. I try to lead with empathy. I try to lead with my heart.
Both crucial elements for building trust.
If you don't trust your provider, seek another one. Because it's very important that you're able to express yourself. If you can't express yourself, it's not going to work and you're not going to be in the optimal state of health.
And guys, there are lots of complicated reasons why gay, lesbian, and trans patients sometimes have less access to health care, but the National Institute of Health, the NIH in Washington, D.C., acknowledges that the causes are not fully understood and that there needs to be some more research to figure out what's going on.
Sheldon, thank you. And what that doctor said, if you're not happy with your provider, seek others.
Yeah, no, and I can't stress enough how important it is to have that trusting relationship with your doctor, because if they don't know what they don't know, then how are they going to treat you and screen you? Because there could be a complicated, a web of everything underneath all of that. So.
Especially when you're talking about your health.
Yes.
Of utmost importance.
Yes.